So, Bismillah ar-Rahman ar-Rahim. First of all, I would like to thank Liaquat University, especially for inviting me to this occasion. My teacher and mentor, Dr. Adnan, and Dr. Arshi Nas for all her, coordinated efforts for this. So, I'm speaking here on the topic of sustainability. But before that, I'm extremely privileged to be speaking in front of people like Dr. Shahzad Ali Khan, Dr. Shahana Uruj, Dr. Anila Bari Saab, Nadeem Kamar Saab, and finally my mentor, Tipu Sultan Saab. And Tipu Saab se main bagaye guidance bhi leta rehta hun. So I'm extremely, obliged and privileged. So the topic is actually sustainability for pharmaceuticals. And when we talk about it, we talk about their role, their importance. So as a lot of people do not know me here, so just a quick introduction that I am a graduate of Dow Medical College in the year 1996. I went on to IBA and then finally did my MBA from Iqra University. And my professional career is actually spanning around some multinational organizations, mainly IQVIA, which formerly was known as IMS Health, Sanofi, Abbott, and now DigiTrends. So I am looking after the digital arena now. So it's already I'm sustainability frontier. And part-time, I'm actually teaching as a lecturer, as visiting faculty in Bahria University, as well as in Dow University of Health Sciences. I'm also consultant to a fitness gym, which is Body Shape. And I'm planning to have a startup of a Quran online academy soon, inshallah, with the name of Al Marfa Online Academy. Recently, my mother actually, fell a victim of stroke 3 months back. And me being a doctor, I missed a lot of things of, getting her to the right place at the right time, because stroke mein aapko pata hai, bahut sari cheezon ka khayal rakhna padta hai. So I thought I should, invest my rest of the life towards spreading awareness on stroke. So to all the people over here, especially the younger audience, let me know that there are few things that you need to remember, because aapke father, aapki mother, aapke grandparents, kisi ko bhi is tarah ki koi cheez ho sakti hai. Just a minute and I'll shift on to the topic. So that is called B fast. So B stands for balance issues. E stands for any problem in eye vision. It can be double vision. Then fast. F stands for face drooping, because half of the face is actually going away. Then A stands for arm weakness. S for speech difficulty. And T stands for the precious time that you need to rush to the hospital, because अगर आप 4.5 घंटे के अंदर हॉस्पिटल पहुंच जाते हैं तो आपको एक इंजेक्शन लग सकता है, आपके पेरेंट्स को है, किसी को भी अगर होता है, और वो लाइफ सेविंग भी हो सकता है और डिसेबिलिटी से भी बचा सकता है, बिकॉज स्ट्रोक इज़ अ डिजीज़ which is the number 1 cause of disability in the world and the number 2 cause of mortality. So it is really a silent killer, I would say. So be fast, आप लोग याद रखें. और World Stroke Day is coming on 29th of October. I'm planning with a team of neurologists, because I'm working in collaboration with the Pakistan Stroke Society and Karachi Stroke Initiative. We are doing workshops in Dow, in Bahria, in Iqra University, in Generations School. So inshallah, this is going to be my ongoing mission. So just a disclosure that I've never received any grant or incentive from any third party. So the agenda is, I'll give you a quick glance about the pharma market in Pakistan, its importance and challenges, and what should the farmer do now, the way forward. So the Pakistan pharma market is around 750 billion rupees, and which is growing at a very hefty pace, which is around 15% CAGR that we see, and it's totally out of the pocket, just as Dr. Shahzad ne bhi kaha. And major driver is population, because we see कि population जो है हमारी जिस level पे grow कर रही है, उस level पे चीज़ें बढ़ नहीं रही हैं, उस facilities provide नहीं की जा रही हैं. And the dilemma is that Pakistan has lowest percentage of GDP attributed to health, which is less than 1% now. 759 pharmaceutical firms are working right now, and some are also manufacturing for MNCs, which is called toll manufacturing, and 95% of the material is imported. National companies, they have outpaced multinationals, in terms of growth, and now have more than 70% of market share in the pharma market, the national players. I worked in IMS Health, and at that time we used to tell our clients that in 1982, multinationals had 80% of the market share, and now they have around 30%, and some of them are now wrapping up very fast. Getz is currently ranked number 1, followed by GSK, Sami, Abbott. I missed somehow over there. Abbott is also there, then Searle, Martin Dow, and Hilton. So this is just a quick overview of the pharma market. We always use the word footprint, which is kind of has a negative connotation, but there is also a positive handprint of pharma market. And we see that the public health and well-being, where we see globally there's a lot of research and development being done, production of medicines, healthcare products, economic growth and job creation, healthcare access and affordability, large population, obviously हमारी बहुत ज़्यादा population है और limited access है to healthcare services, and there is export potential. So this is kind of the positive impact we see of pharma industry. However, it has significant challenges, and there we come to the footprint of carbon footprint, because from the extraction of the raw material to the disposal of the drugs, there is an entire value chain which is subject to carbon emissions. And this is the carbon footprint which the pharma has to control, and that is spanning from manufacturing to transportation and disposal. The pharmaceutical sector is accountable for 4.4 of worldwide emissions, which is significant. And if there is no action taken on this, its carbon monoxide emissions, dioxide emissions are predicted to triple by 2050. So we really need to take care of this. There is a calculation, I am sure Dr. Adnan would be quite interested to see this, that for every 1 million revenue that comes from the pharmaceutical industry, the pharmaceutical industry produces 48 ton of carbon dioxide. So as I told you that the market, Pakistan market is around $3 billion, this goes to around 148 lakh ton of carbon dioxide, which is significant. And this is, again, much higher than what automotive industry is producing per se. So what should pharma do? Now, this is the key topic of today. There are alternative transportation models now. So moving towards hybrid model, using electric vehicles to reduce emission. Waste reduction, implement sustainable packaging solutions using recyclable, biodegradable materials, reducing the size of packaging. Like Abbott introduced Freestyle Libre, which is a glucose monitoring device, and they intentionally launched it in reducing its total volume by more than 70% and reduction in plastic use by 41%. So this was the kind of intention of launching that product as well, to keep it sustainable. Green chemistry is something that is also being applied to minimize the use of hazardous materials and also to reduce waste. One thing that I'd like to share here is the disposal of syringes in Pakistan. In hospitals, because I worked in Sanofi, and we used to have an injection called Clexane, which is enoxaparin sodium, and used for cardiology patients a lot. So there was a tendency that, in certain hospitals, the paramedic staff did not used to actually dispose it off properly. And there was also a risk of abuse of those syringes. So this is, dramatic. These kind of practices are not going to be positive for the country. So this is something that I wanted to share with you. The other thing is water conservation. A huge amount of water is used. Can we save that? Abbott did it. In 2009, they reduced and saved up to 1 billion gallons water annually. Renewable energy using solar, wind, and geothermal, technologies. So there is a company globally known with the name of Amgen. There is the newest biomanufacturing plant in New Albany, Ohio, which includes solar panels, LED lighting, energy-efficient technology, and other sustainable equipments. So addressing the social responsibility, finally, I still remember when I was in Sanofi, we used to go to several places, including beach, where we used to clean the beaches for all that, waste products, and to just ensure disposal of waste properly. So this is something all about it. I'm extremely thankful for your time. It was wonderful presenting here. Thank you very much.